Hello and welcome to The Voiced Self. I'm Holly Saxon, a vocal massage therapist, and I'm here with Eve Mitterhuber, a speech and language therapist. And today we are going to cover Eve's personal journey around voice and her experiences in voice therapy, with particular focus on the role of voice in communication and self-expression. So welcome, Eve.
Thank you very much. Hello.
So this is a slightly different take for us, and I'm going to be asking you a series of questions. So shall we get started?
Sounds good to me.
Okay, so as a speech and language therapist, you are an expert in the voice. But what I'm interested to know is, what was your personal voice journey? Was there a specific moment or realization that led you to specialize in this area?
So when I became a speech and language therapist, I actually wasn't that aware of how much our role can involve voice. When I was at uni studying speech and language therapy, we did a module or two on voice, which I found kind of interesting, but I think it didn't really spark my interest until I started my role as a community adult speech and language therapist, and that role involved quite a lot of voice. We have a lot of patients who are referred to us from the ear, nose and throat service for voice therapy. And going in as a very junior speech and language therapist, I went in probably not as prepared as I'd have liked to have been, and started assessments and giving advice and therapy. And as I've got more and more experienced with it, I've just found it so interesting as to how much our role can impact people's lives. People who come to us who maybe lose their voice seemingly out of nowhere, or for a very obvious reason, like maybe some trauma or nodules or vocal fold palsy, for example, and how much of an impact voice can have on their day-to-day lives, on their work, on their family life, on their social life. And the more and more I've got to know about voice, the more interested I've become in how our role can be so vital. I think it's worth noting here that there's a big variation of how speech and language therapists work with people with voice disorders, and some people specialise in various different areas, such as head and neck cancer, or sort of very physical voice problems. And my service is quite a sort of general service in the community, which I find has made me very lucky in being able to experience such a wide variation. So yeah, I think it's been something that I didn't quite realise I had a passion in until recent years and gaining that experience.
Really interesting. And can you tell us a bit about that range? So, you're sort of saying there is a range of clients that you see, and that's then kind of piqued your interest. Can you just talk a little bit more, maybe with some examples of particularly interesting cases that you've seen?
Absolutely, yeah. So the majority of people that are referred to our service will have been to see ENT and might have muscle tension dysphonia, which we've spoken about before, change in the voice because of excess muscle tension. They might have been diagnosed with acid reflux, and so we will give a lot of sort of general advice, day-to-day advice about those. But some really interesting cases that I've had is where the people don't necessarily respond to therapy as how we might expect. So one case in particular is someone who was referred with muscle tension dysphonia, and she worked as a nurse, and her voice difficulties were causing her to be basically totally aphonic, which is where the vocal folds don't come together, they don't create a sound, which meant that it sounded almost like she was whispering. There wasn't any sound coming out, which, working as a nurse, made her job really difficult because she'd need to talk to lots of people every day over lots of background noise, and in an emergency she wouldn't have been able to be heard. But it was a kind of typical referral that we had where she'd been to see ENT and just said muscle tension dysphonia, try voice therapy, see how you go. And so we started off with sort of some general advice around voice care, vocal hygiene, drinking lots of water, resting her voice. She did have to take some time off work for her voice to recover. And we started some exercises, many of the things actually that we've spoken about in our previous sessions, maybe some straw therapy, some relaxation exercises, some breathing exercises, humming, all to help release some of that tension and get the vocal folds moving. And then we tried some vocal massage, and she responded really well to that. I remember in our first session, it didn't immediately change her voice, and we wouldn't necessarily expect it to, but she came to me sort of as a follow-up, and she said, for those few days after the vocal massage, where we were working around her face, around her jaw, around her larynx, she then said that she had really good voice, a nice clear voice, for a decent amount of time, a good few days. And that was a really nice example of actually how much those muscles, the tension around those muscles, were actually affecting her voice. Another thing that we did was think about, well, how can she reduce the burden on her voice? And by that point, she had returned back to work, and she was finding that her voice was tiring towards the end of the day. So we came up with these practical solutions, and I actually gave some feedback to her workplace on how can we take away some of this burden and pressure, and just by doing some really simple things like giving her some more admin work in the afternoon so that she didn't have to use her voice for the whole day, and could use it more in the morning when it was feeling easier to use, it was feeling more sort of primed and ready to use after a good night's sleep and lots of rest. By doing that, that's actually meant that the longevity of her voice has maintained, and she's continuing to experience these improvements. I think that's a really good one to demonstrate how, when you think about holistically the day-to-day ongoings with her voice use and work and outside of work, combined with all of these different elements of voice therapy, the physical voice exercises, combined with the massage, combined with the voice care, that's made a huge difference. And that's just one of many cases that I could talk about.
Really, really interesting. So in that case, it sounds like it was actually kind of tiring of the use of the voice, and maybe using it too much or excessively, or not taking enough rest in between. Is that your view of it?
Yeah. So she was using her voice a huge amount, and with the muscle tension dysphonia, she was using it with strain. So it was already starting off feeling strained, feeling tight. And so if you start from there and carry on and push through it, then it was only going to get worse throughout the day with that increased use of voice. So when we were then able to actually release some of that tension through the massage, she could then get more benefit from the exercises because she could use her vocal folds more freely, but then also could understand when her voice was getting more tired, more strained, because it was starting from a point of feeling more relaxed. So she could then feel where her voice was and try not to get to that point of tightness, strain, fatigue.
Interesting. And I think we've spoken about this before, isn't it? It's that sense of, well, we've all got a voice. We don't ever think it can get tired or stressed or break until you've been in that situation when that's happened to you. Do you see that a lot from your clients?
Yeah, absolutely. I do see that a lot in my clients, and I do see that a lot in myself as well. I think it's really important to reflect on, well, how am I feeling in my voice today, especially with a job like the one that I have, but anyone's job for anyone who uses their voice a lot, if you if you notice how your voice feels, then it's much easier to actually stop it from getting to the point of strain, excess use, sort of stress. Easier said than done, but I think if you have that awareness of how you're feeling in your voice, then that's a really, really good starting point to avoid sort of developing further problems with your voice.
Yeah. And I think when you're saying that, I probably relate it to sporting or training or being in the gym, or equally actually when you've got a cold or when you're not feeling 100%, your body, you can feel it in your body, right? And some people often push through that. And I guess the same applies in the voice context too.
Yeah, absolutely. And I think in sessions that I do, it's really helpful to actually have that open reflection. You know, I ask people, how are you feeling in your voice? But then it really helps me to say to them how I'm feeling in my voice so that they can then hear that. So it might be that I've seen sort of 2 or 3 clients already where we've done, it might be a initial assessment, which is a lot of talking. And so I might have been talking for, a good hour and a half to 2 hours. And I may say to them, well, my voice is feeling a bit tight or a bit strained now. Tell me about yours. And I think if you have that open reflection, then it can really be useful for other people as well to notice that. And I think as well, we often don't do that. So yeah, like I said, I think awareness is always a really good first step.
Absolutely. And thinking of the voice as a tool, how do you personally feel about your own voice? So you're saying that you've had some reflections on it, but do you find that you pay more attention to your vocal habits than the average person because of the work you do? And how do you consciously care for your voice?
That's an interesting one because I'd like to say yes, and that I probably do subconsciously, but I'm aware that some days my vocal habits aren't necessarily the healthiest in terms of maybe talking a little bit too much. But mainly what I try to do is hydrate throughout the day, especially on a day where I'm using my voice a lot, and try to do some stretching, some breathing, and some relaxation, sort of stretching out, like we've spoken about before. Again, deep breathing exercises, stretching out the neck and the shoulders. But I think in terms of my journey with my voice, it's everyone's journey is very personal, and for me, I have used my voice maybe not as much as a lot of people. I think I've always been seen as a relatively quiet person, and maybe there's been some element of not wanting to be the loudest person in the room, and so rarely would that be the case. But then equally, I have done quite a lot of Amdram in the past, and my reflections of my voice then have been really interesting because I find it relatively easy to stand on a stage and project my voice across a room of maybe 100, 150 people and be heard. But that's much easier to do when I'm reading out a script or I'm in character, compared to if I were to do that as myself. I think there's quite a lot to be said for maybe being yourself, being in front of people, and sort of how your history of how you use your voice and your own sort of personality is, can be shown in the voice itself.
And I think that's really interesting because you hear often that there are a lot of actors and famous stars that feel exactly the same, that if they were to be themselves on a stage, then they wouldn't be able to do as well as when they've got that character or persona, or they're playing someone else, right? And I hear that quite often. Do you see the clients that you see do something similar? Are there ways that you've seen them masking their voices somehow?
Yeah, I haven't necessarily seen it within my sessions because when we're doing our sessions, we are in one room together. It's, one to one. Maybe they might bring someone along to sort of be involved in that discussion, which is also really helpful, I think, to have someone else reflect on your voice with you. as a bit of a side point. But I do have people who might say that they struggle to project, which is very common. So I've seen people who are maybe do lots of presentations, and when that is the case and it's more a way of fatigue, and there are ways around it, that is when I would consider more, well, how much do you need to project your voice? Can you use a microphone instead? Sometimes I'll say that to teachers as well, because we're wanting to preserve their voice as it is as a talking voice. The work that I do is centered around the talking voice, the day-to-day voice. And whilst I do talk about projection and sort of projection techniques, sometimes a little bit around singing, the main area of focus in my work is how can someone improve their talking voice in day to day, and how can we think about strategies, practical ideas, practical ways to bring maybe some projection, or maybe the comfortableness of how they can sit in their normal talking voice, bring that back to how it might have once been when they come to me in a place where that's quite difficult for them. Does that make sense?
Yeah, really, really interesting stuff. And I find it fascinating almost that it is that talking voice that you experience, well, that your clients experience the challenges with, because like I said, unless you've been in that situation where your talking voice is impeded in some way, you wouldn't necessarily think that it happens, or that there are people that go through that journey. So yeah, just really interesting that it's working on something which seems so straightforward to a lot of people, that others do struggle with, and I need to think of ways in which they can, I guess, get around that journey day to day.
Yeah, absolutely. And I think that's also a really interesting point, because a lot of people will come to voice therapy without having any idea of what it involves. I mean, I had a lady that just this week who I've had a few sessions with, and she said to me, she was speaking with a friend at a group, and her friend said that they had a friend who had also experienced similar voice difficulties that she was describing, and she's linked up with this person, and actually this person has said, well, there's a Facebook group that we can join where people talk about their voice difficulties. I'm not 100% sure on the details of that, but she was just telling me that in joining this Facebook group and reading through other people's experiences with their voice, her knowing that it's not just her, there are other people out there that experience similar difficulties, has been really helpful alongside voice therapy. And maybe that's something I should build into my therapy a little bit more. And actually, I'm trying to with voice groups at the moment, but that's another little side point. But I think in bringing people almost into a community and knowing that they're not alone, because it's really helpful, because voice difficulties can be quite isolating, especially for people who maybe aren't in a professional voice world and maybe have never spoken about their voice before. It can be quite eye-opening.
I think that's really interesting, even, and I think that isolating point is also quite key now in terms of how we all work differently post COVID. A lot of work is done at home, even some vocal therapies, some vocal coaching. If you don't have to have that manual contact, a lot of people do still do things remotely. And I think that can maybe exacerbate that feeling of isolation and being on your own. And then that sense of community that you say is so important is also lost. And the more you're away from that community, the more you isolate, the more isolated you become.
Absolutely. And I've had people who I've seen, because I worked throughout COVID. I actually started working at the beginning of COVID. So my voice work has involved a lot of discussion around COVID. And I've spoken to quite a lot of people who have said that throughout the pandemic, when they were isolated, that's when they started experiencing voice difficulties. Maybe one, because they were using their voice less, so when they did use it, it was harder to use. But also, I think around going back to that element of self-expression, because people were isolated, they weren't able to express themselves. They were holding back. And also there was a lot of fear, a lot of tension sort of in the world. So I think that that element of self-expression was almost taken away without people realizing. And it's just really interesting that you brought that up, because that's something that does, or it did come into conversation quite a lot. No, not so much now in 2025, but it did come into conversation a lot, where people were just struggling with both how they were feeling and then how their voice was being perceived, or how they were perceiving their voice.
And we've spoken about this before, haven't we, in terms of that connection. Often you'll see clients that don't have a mechanical issue, a biomechanical issue with their voice. There's nothing there in terms of an issue for that to be functioning normally, yet their sound cannot be created because of other reasons. So I don't know if you want to touch on that lightly.
Yeah, I think we've mentioned before about the sort of psychological impact on voice, and it is something that I see quite a lot. And for some people, I see it being the kind of the predominant factor is maybe they might have a functional or a psychogenic voice disorder, and those can be really difficult to unpick, because that link between voice and how we're feeling and self-expression is so tightly linked and so innate that it can be really difficult to get to the point of knowing what is the trigger. And that might require a group of different professionals, different disciplines. Sometimes speech therapists can be useful for that, for unlocking that area a bit, but also it might be then about referring on for counselling or CBT or psychology. But often what I find with that is it can take quite a long time to get to the point of recognising that, oh, this is maybe more of a psychogenic voice disorder, in the absence of there being a physical diagnosis that has been found in an ENT assessment. It's a big topic, and there's never going to be, and there shouldn't ever be, a one size fits all. That really is about managing and considering various different things for that particular individual.
That was interesting. And I'm just wondering, a bit of self-reflection now. Do you feel that your voice, in terms of its quality, stamina, or presence, has improved over time, specifically because of the knowledge and therapeutic work that you do?
I think my voice does vary with this one. I think I have noticed that whilst I am more aware of maybe voice care, vocal hygiene, when my voice might be tiring a bit more, that doesn't necessarily mean that my voice is good all of the time. I definitely notice when it's fatiguing, so when I am maybe using it a little bit too much. But I also have noticed that it can definitely tire a lot more easily during times that I'm feeling maybe a bit stressed, or haven't been able to take some time out for myself. So I think whilst my voice hasn't necessarily improved, I think my awareness of my voice has improved, which can maybe mean that it can recover. I can be a little bit more careful around what I need to be doing to take care of my voice much more easily. But sometimes I do say to people, I do have to practice what I preach, and sometimes I can forget that.
We're all the same. We're all guilty of that, I think. And I guess you touched a bit on earlier in terms of people coming to you with speech impediment or a challenge. But can you explain or think of how speech therapy can play an important part when someone doesn't necessarily have an impediment, but a little bit with that vocal quality, projection, and confidence?
Absolutely. I think with the work that I do in the NHS, I do think it sadly does vary from where you're living, what is available locally for people. Although I do believe that a lot of places do have really, really good speech therapy departments. But I can only speak for what I do with people that I see, and so we'll always start with an assessment, thinking about what did ENT see when they saw you, what does day-to-day life look like for you, what level of voice use do you have, how do you use your voice, what's your work life like, what's your home life like, how are you using your voice in these different contexts, and also thinking about maybe how are you taking care of your voice, thinking about smoking, thinking about alcohol, caffeine intake, thinking about foods and drinks that you're eating and drinking, and then we will tailor our advice to that person. So if someone has a really busy work life and they're in lots of meetings, then I will start to think about, well, what practical steps can you take to, one, relieve some stress from day-to-day work, if that is a factor. It might not be for everyone, but definitely consider that element. And then thinking about, well, how can you maybe take care of your voice? How can you keep hydrated? How can you maintain some element of relaxation in your voice? How much can you rest your voice? And again, this one really does vary for everyone. If they maybe don't work and they have various different sort of activities in their home life, then I will be thinking about, well, how much are those activities impacting? Are you exercising a lot and speaking when you're out of breath a lot? That can increase some tension in your muscles around the voice. Are you raising your voice a lot? Lots of people have dogs and they might shout to their dogs if they're at a far distance when you're out on a walk, or have young kids. That comes with its own stresses and its own level of voice use as well. So yeah, we'll start to think about some practical things, and then we'll start to build in some exercises, again tailored to that person, and sort of see where we need to take it. Like I said before, everyone is different, so everyone's voice journey looks different. Sometimes we might need to recommend that they seek extra support from elsewhere, whether that might be some psychological support for whatever might be going on, or it might be considering, do they need to have any other investigations, or do they need to maybe seek a vocal coach if their problems are maybe more in singing, or do they need to maybe consider a little bit more relaxation, body massage. Yeah, I think we take a holistic approach, a person-centered approach, which is really important because everyone's voice is different. But the things that I've mentioned are some main points that can apply to everyone, really mainly the resting your voice where you can, and drinking plenty of water.
And I think that that's a key point, but a lot of people don't like water and therefore don't drink water. So it's the vicious cycle, isn't it? That's the only way that you can bring relief and hydration to your throat and help that traction. And that's a really key one, I think, not just for voice use, but I think, general health and well-being.
Yeah, absolutely. And I always say it's not about, when it comes to voice care, it's not about glugging a load of water. It's about taking small regular sips throughout the day. I think that's the main point that I would recommend to everyone, really. Small regular sips throughout the day. I've been doing it as we've been talking. It doesn't take a lot of effort, and even if you don't like water, taking a sip, if you've got water nearby, that's not going to be a big burden. It's just going to feel quite quite nice on the throat, quite soothing.
And I really like what you said about the holistic approach and you know, the mention of the day-to-day things. So it's people who are exercising and they might be jogging with a friend, or I don't know, on a court playing tennis, and they're maybe talking while they're straining. You say even having children or pets and maybe raising your voice. So all of these sorts of things I think we take for granted. It's just part of the day. And we don't necessarily think of that impact that it's having on our health, our voice, and our general well-being, from that holistic side of things. So that was really, really interesting. And for myself, I would say as well, I think sometimes struggling with the feeling of having something valuable to say. So maybe being okay in a situation where I'm exercising or walking a dog, but actually when I'm wanting to contribute, that sense of feeling like, have I got a valuable voice? And how do you help your clients connect with their authentic self-expression through their voice?
Yeah, that's a really fascinating question, actually, because a lot of people can have that feeling. And we've spoken before about imposter syndrome and about the feeling of, well, why do I have to say what I have to say? Maybe the person next to me, if they have a louder voice, maybe they can say it better. And I can certainly say that I've had very similar thoughts and still do sometimes. I think, again, that comes back to awareness around the voice and talking to people about what their current experiences are of their voice and where would they like their voice to be, but also the reassurance that everyone's voice is important and every single person has something to say. And even if you feel less experienced or less valuable, your voice is still important. Your voice still should be heard. And I would say that goes for everyone. It's not necessarily a matter of who speaks the loudest, especially not when you've got a voice problem. But it is important that you do express yourself, because if you don't, then again, that can lead to further tension within the voice, further sort of tightness, holding it in. We've all had that feeling of holding something in, holding back. And if you think about that feeling, where do you feel it the most? Probably in your throat.
I just did that actually as you were answering that. I imagined me trying to speak and holding back, and my neck went back. My shoulders raised slightly, and it was that sensation in my throat of kind of restricting myself. And I think that's a really important point you've raised there, in that physical tension in the jaw and neck and throat just from that movement. So what do you think is then the most immediate physical benefit a client can experience once they start breaking that cycle of holding back their voice in those situations?
And we would be hoping for a release of that tension. Really, that's what the aim is feeling more free within the voice. And again, this is one that's different for everyone. But and what I quite like to do is sometimes say, well, how would it feel for you to unlock that voice? How would it feel for you to not hold back? And most people will say, well, it would feel more free, it would feel more relaxed, it would feel easier. That's what we're hoping for. Easier said than done. I suppose that's a big thing with speech therapy as well, is that we do have a limited time with people. And so actually a lot of the work that people do with their voice would be outside of sessions. It's about carrying through those discussions into day-to-day life.
Yeah, and I think we have covered that before, even one of the sessions where we said, you know, if you go for a massage or even a self massage, it will help ease the tension in that particular moment in time. But then if you go straight afterwards to sitting at a desk with your shoulders hunched over, or like in the voice case of walking a dog or shouting or screaming or using excessive effort to speak or create sound, you're kind of undoing that good in the moment massage, you're not then taking something away that's then reusable, repeatable, and taking the whole holistic self into consideration.
Yeah, absolutely, a really good point.
And may or may not have been for you, but I don't know if you've got any particular interesting story, or I guess a light bulb moment that you've experienced with either your own personal voice journey or a client regarding their vocal recovery.
I haven't had, in myself, I haven't had a necessary light bulb moment, but I have had a few clients who have had one session with me where we'll just talk about various different elements that I mentioned earlier. And then maybe I'll call them up for a check-in. And for this is, I would say, a small minority, but I have had it where a few people have said, you know what, my voice is fine now, because all they needed was that awareness, a little bit of advice around the healthy vocal habits, and almost permission to say, look, this is real, these are some things you can do, this is why you might have experienced these voice changes. It's whenever that does happen, it's so great, because it's almost like unlocking something just by raising their awareness to it. And if that doesn't happen, that's absolutely fine. And I never expect that to happen. But when I have called someone up and they said they had a bit of a light bulb moment just by, it might be something really simple that I mentioned, like, I remember one chap in particular just started drinking sips of water, and I got him to put post-it notes on his desk, on his phone, in his wallet, by the front door, in the car, just in all sorts of places, just as a reminder. And he said as soon as he started doing that, his voice returned to normal, and it was okay. And that's one example of a sort of a light bulb moment. That was all he needed. For some people, that wouldn't be the case, and that's okay. But I think it's really interesting that just having those conversations and giving that advice can open back up that world of easy voice use.
Really, really interesting. And like you say, it's then giving them that awareness to be, as you quoted it, free, relaxed, and easy.
Yeah, absolutely. Whether that carries on, whether that maintains for a long time, I don't know, but I would hope so.
Good starting point, if not.
Yeah.
Okay, great. So I just got two more questions for you before we close the session today. So where do you see your voice journey going to next?
Interesting question. I've got a few things in the mix going on. And I suppose it might be something that we talk about a little bit more in the future. And I will leave that there for now, a little cliffhanger.
Very intriguing. I look forward to hearing more about that as it evolves. And as a final question then, what one key takeaway would you recommend for our listeners and any voice user?
Hydrate. Really is that simple. That would always be my main thing, is regular sips of water throughout the day. Only need one small sip to hydrate the voice, and just try and keep up with that. Really, really simple.
That is super. That's a super simple tip. So I'm on my way there already. I hydrate quite a lot, so I feel like a winner today.
Good, excellent. And I was taking a sip of water as you said that.
I just wanted to say thank you so much for taking us through that today. It was really, really interesting and insightful. And yeah, thank you for sharing your personal journey.
Well, thank you, Holly.
So we hope you've enjoyed the session and found that content useful. And if you have liked what you heard, please do drop a like, a comment, or a follow, or even share this with a fellow voice user. You never know how much you can help someone just by helping them be more aware of their own voice and situation. Next time, we will be reversing the roles, and Eve will be asking me to share my voice journeys. But until then, Look after yourself and your voice.